Okay, so good morning, all of you.
Good morning, ma'am.
Please write your proper name. Who is this PC? In the participant list, this PC is written. Please write your name, your full name, okay? And Surajit, are you ready?
Yes, ma'am.
Okay, your network is good?
Yes, ma'am.
Okay,
I manage.
okay. So you, what is your
Ma'am,
topic?
is my voice is clear?
Yes, it's audible. What is your topic?
Hemodialysis.
Hemodialysis. Okay, so you turn on your video. You will be doing share screen.
Yes, ma'am.
Acha. Okay, you can share your screen now. So before that, introduce yourself, introduce the topic, and ask the group if they know anything about a topic, and then you can start. Okay. Turn on
Okay,
your.
ma'am. Hello, everyone. I'm Surajit Kalita, and my topic is hemodialysis. This is completely new topic, so please pay attention, everyone. Ma'am, is my screen is visible?
Yes, Surajit, it's visible. It's visible.
Okay. Hemodialysis. Hemodialysis, it is the removal of solids. Yes, ma'am.
The topic that you have written hemodialysis. Hema nohoy. Here you have written correctly. Hemodialysis. Here you have written hema.
Oh, sorry, ma'am. It's typing mistake.
Okay.
Hemodialysis, it is the removal of solids and water from body across a semi-permeable membrane. मतलब ये हमारे बॉडी से सॉलिड्स एंड वाटर रिमूव करता है across a semi-permeable membrane, मतलब dialyzer. Father of hemodialysis, William Kolff invented the first artificial kidney. Principles underlying diffusion, osmosis, ultrafiltration, and solvent drug. Okay, let's discuss about diffusion, movement of molecules from an area of higher concentration to an area of lower concentration. मतलब molecules हमारे higher concentration area से lower concentration area तक move करता है. Osmosis, ये इसका उल्टा है, movement of solvent molecules from lower concentration to higher concentration. Ultrafiltration and solvent drug. Water moves from an area of high pressure to an area of lower pressure. More efficient in fluid removal than osmosis. Molecules which are dissolved in the solvent also get removed. It's solvent drug. Indications: acute positioning, acute renal failure, severe edema, chronic renal failure, hepatic coma, metabolic acidosis, hyperkalemia, postpartum renal insufficiency, cardiac tamponade, fluid overload not responding to diuretics, and fluid restriction. Contraindication: other chronic disease, no vascular across, hemorrhage, hypertension, very old people, inability to cope with treatment regimen, inability to survive pressure. This is the diagram of hemodialysis. The system of hemodialysis. A typical hemodialysis system consists of a water supply, a system for mixing water and concentrated dialysis fluid, a machine to pump the dialysis fluid through the artificial kidney. I think everyone understands this line, which are referred to as hemodialyzer or dialyzer, bacterial and chemical containment in hemodialysis system. The dialyzer is connected to the patient circulatory system, and the blood pumped through it to accomplish dialysis by means of a membrane to remove waste product for the patient's blood, bacterial and chemical containment in hemodialysis system. Patients should have a specific station assigned to them, like chair and table should be clean after use. Sharing of uh, ancillary supply like BP cuff, thermometer, trays should be avoided. Non-disposable items should be clean or approximately disinfected between use. Medication should be proper and distributed from centralized area. Infection, assault with hemodialysis, it means it's a risk factor. Dialysis patients have a compromised immune system and other disorder that place them at risk for infection disease. Next is prevention of infection at hemodialysis. Patient with infection shall be treated in a separate room and use a machine designed only for patient with such case. Dialyzer of the patient with hepatitis shall be discarded after use. Staff nurses should not smoke, eat, or drink in the dialysis treatment area. The patient's dialysis record should include all mishaps, demographic data, laboratory results, and all incidents like needle stick injury. Also include the machine use and prophylactic measures. Okay, ma'am, done.
Okay. You ask your friends if they have any doubt.
Anyone have any doubts?
No.
Okay.
Okay, you can ask
Can I ask
questions.
question?
Yes, yes. Ask any 10 participants.
Okay, ma'am. Krishna. Hello, Krishna. Krishna is absent, I think. Finisha.
Yes, Surajit.
What is the another name of hemodialyzer?
Artificial kidney.
Okay, thank you.
You're
Next,
welcome.
Bisal.
Yes.
Hello, Bisal.
Hello.
What is
Yes.
diffusion? What is diffusion?
Movement of molecules from an area of uh, higher concentration uh,
Higher concentration to an area of lower concentration.
lower concentration.
Yes, yes. Okay, thank you.
Thank you, Surajit.
Next, Tumpe Zilan.
Yes, Surajit.
What is osmosis?
It's a movement of solvent molecules from lower concentration to higher concentration.
Yes, thank you.
Thank you.
Malvina,
Yes.
one prevention of infection at hemodialysis. One
Mm,
prevention only.
okay. Staff nurse should not smoke, eat, or drink in the dialysis treatment area.
Yes, thank you.
Welcome.
Pabok lang.
Yes, Surajit.
Please say two indication of hemodialysis.
Acute poisoning and acute renal failure.
Okay, yes, right. Thank you.
Welcome.
Giriza. Hello, Giriza.
Yes.
You say two contraindication.
Yes.
Two contraindication.
Other chronic disease and no vascular access.
Yes, not vascular access, is no vascular access. Yes, it's right. Thank you.
Thank you.
Next reason.
Yes, Rodit.
How many dialysis types are there?
There are two types, that is peritoneal dialysis and hemodialysis.
Yes, right. Zamnunu. Zamnunu. Hello, Zamnunu. Next, Nafisisa.
Yes.
You say one definition. Definition. You say definition. Sorry.
Hemodialysis is the removal of solutes and water from the body across a semi-permeable membrane.
Yes. Thank you.
Welcome.
Likayatu. Likayatu. Rich person. Rich person. No one is replying. Ma'am Dan.
Ask any two participants, Surojit.
Okay, ma'am.
Any two participants.
Ma'am Sally.
Yes,
I mentioned only one risk factor. What was that?
risk factor.
Yes.
Sorry, I don't know.
Okay. Dialysis patients have compromised immune system and other disorder that place them at risk for infection disease. It's the risk factor.
Okay.
Okay. Rosmi.
Yes,
Who is the father of hemodialysis? Who is the father of hemodialysis?
William Kaur.
Yes, yes, right. Ma'am then.
Finish, Surojit?
Yes, ma'am. Yes, ma'am.
Okay. Okay then. I think the topic is clear to all of you. Did you have that topic before? Hemodialysis? Class was any idea about that?
No, ma'am.
No. Okay.
What?
Acha, yes. But good. Okay, your effort was very good. And also, you tried explaining it well. I think many of the participants, I think they even understood what you tried to convey. And regarding your presentation, overall it was a good presentation. And also I was seeing your network since before you only used to give in chat box. But today
Yes,
you have
ma'am.
come out somewhere, I don't know. So naturally it's also good. You have put effort, I can see that. So it's all about effort, okay, Surojit?
Yes, ma'am. Thank you.
Very good. Okay. So you try better again next time. And after all the seminars, if I get time, I will take all these hemodialysis and these and the topics. Okay. Although it is not there in
Okay.
my syllabus, but I will try to explain in the next classes. Okay.
Okay,
And
ma'am.
participants are also active, so it is a good thing. What about tomorrow's presentation? Who have got the seminar?
Hello, ma'am.
Malvina.
Yes, ma'am.
Okay, what is your topic?
Kidney transplant.
Kidney transplant. Okay. So tomorrow I think I will be taking seminar at this time only. Okay, or do you have class at this time tomorrow?
Yes, ma'am.
Classes? You have classes?
Yes, ma'am. CRT.
Oh, acha. Okay then, I will try to take after 12:30 then. I will inform you all. Okay.
Yes, ma'am.
Okay then. Start studying also, okay, all of you. Start studying. Your finals will be held very soon, I suppose. Whatever it is, but you will have to study. Okay, whatever things I completed, you study from there. And if there are some extra MCQs and that, all those I will just check it out and I will give you in WhatsApp later, but not now. Okay, so you all can start studying. Okay. Okay then. Thank you. You all can leave the class.